My name is Shelby Wagner and I am from Crawfordsville, Indiana. At the age of 15, my mother actually noticed that I had scoliosis. It's a genetic disorder. My mom has scoliosis. And so one day I was bending over and she noticed that I had what's called a rib hump deformity. And so with that, we decided that we probably needed to seek care, find a doctor that specialized in spines, and that's how we found Dr. Schwartz.
So I did a posterior approach on Shelby's curve. She had a little bit of a lumbar curve and a thoracic curve, and we used specialized, we call them pedicle screws, and we would put the instrumentation during surgery into the spine, and then we use a rod that we actually straighten the spine out with during surgery. We monitor the spinal cord during the whole procedure because parents always ask, it's always everybody's concern, do I have to worry about paralysis? We monitor all of that, we align the spine back to where it should be, and then we fool the body into thinking that this is a position it should be and it should heal like that. And then we finish the surgery, we get the kids up that night walking, and most kids back by 6 weeks are running, playing, doing anything they want to do.
So whenever I first met Dr. Schwartz, he was so personable. He made us feel so comfortable. Of course, spinal surgery is routine for him, but for somebody like myself, it's scary when you get that diagnosis. You're unsure, you don't know what to expect, you're concerned about how it will affect your everyday life. He made us feel totally comfortable the second we walked in. He answered all of our questions. He was very thorough in his exam. Of course, I had a lot of questions. As a teenager, I wondered, can I play softball still? Can I do gymnastics? How is my mobility going to be affected? He answered all of those questions. He reassured me that we would get through it together and he would be there every step of the way.
Seeing a patient like Shelby 16 years after her initial surgery, it does a couple of things to me. One is it makes me incredibly happy that this person's been able to go on and have a normal life. But two, everybody's afraid to have spine surgery. There's all these rumors out that I have spine surgery, I'm going to have another surgery and another surgery. And it's really not true. I mean, that's some of the old things and some things that are completely different. When we take care of kids, or when I take care of kids, we do it in a way where hopefully they'll never have a problem with their back again. It finally gives them a chance where they don't have to worry about it anymore. It eases their mind. And then I see a grown woman with 2 kids of her own. It makes me feel like, my life means something. It means something to somebody, and I've actually been able to help kids.